All right, hello everyone. This is kind of a different video than what's been up on my channel previously. This one we're going to call an art lesson. Now, I didn't study art except for one class, but I do enjoy art. I sometimes will paint with acrylics. Actually, I don't know if you can kind of see that bird of paradise. I did that a few years ago. I've got a couple paintings up that I've done. So I'm more like just passionate about it. I'm not very good at sketching, but I have several sketchbooks of attempts. I love coloring with markers. I have adult coloring books I'll bring and color in. It actually really helps my brain to focus too. I focus more when my hands are doing something. That's just how this brain works. OJ was up here behind me. Come here, baby. She jumped down to get some water and she's resting on the floor. So she has to go from one place to another with several breaks in between because she's our arthritic kitty. Lynn's going back and forth watering our plants on the patio. While I'm doing the chit chat portion of this video and the sketching. So one of the things that I am best at is sketching flowers. So as some may know, I had surgery on my ankle last week. A year ago, so like early April of 2019, I fell and broke my ankle and was out of work for 3 weeks and had to be in an orthopedic boot. I did not have surgery at the initial injury. The part of the bone that broke, it was more like a fracture. It didn't completely break off, but the part of the bone that broke off was so small, it wouldn't have fit a screw to reattach it. So it was just put the foot in a boot and be off of it for 3 weeks. I was on very minimal, mostly sedentary, even when I was back to work. Started physical therapy in the summer, and that's when I noticed some swelling. And I had to go back every month to the orthopedic doctor, and I kept saying, I'm still in pain, and there's a lot of swelling, like the toes and the top of my right foot, the one that had the break, and the ankle. Like I kind of have cankles anyway, I will confess, but there's still a little bit of a shape where you can tell where the ankle bone is in the joint, but not on the right foot. It was almost completely flush. If I did a lot of housework, if we went for a walk to get the mail, if I was on my foot, after physical therapy, oh man, it would be so swollen and stiff. And I kept telling him, it hurt. And then finally in September, he said, okay, I'm going to send you to a podiatrist because the orthopedic would only deal with the break. And he x-rayed it, and the break on a non-weight bearing x-ray, and that ended up being important, showed that it was healed. So I took a couple months to get to the podiatrist, got in December, and they took a weight bearing x-ray, which the difference is the non-weight bearing I was laying down and the weight bearing I was standing up. And the weight bearing x-ray showed a different pattern of shadowing. I wish I had the x-ray with me. I actually have it at school in my classroom. That's one neat thing about this whole experience, is that my K1 students have gotten to see the x-rays all along the way, from the initial break to a month later to a couple months later. And then we talk about the difference between the weight bearing and the non-weight bearing and what that does to show the different images in the x-ray as what the podiatrist had told me. And they were just, it was so neat. And he didn't like some of the shadowing and that you could see the line where the break was. So there was possibly some scar tissue preventing the fracture from completely healing. So he sent me for an MRI and had that done in December. Christmas break happened, went back right away in January. Turned out that it was seen in the MRI, which gives obviously a more detailed image. There was a bone fragment that had healed around the ligament, and that prevented the ligament from moving. So all the pain, all the swelling was, my body was doing what it was supposed to do. It sent extra fluid and swelling down to the joint to provide an extra cushion. So good news is my body was doing exactly what God designed it to do. Bad news was that came with pain. So he put me in a brace that I could still wear regular shoes in. And hey, honey, would you plug in my computer, please? Because I can't quite reach. So, and that helped, but still, the longer I was on my foot, the more it swelled and the more pain I was in. And I'm not the kind of person to gripe about personal stuff. Hey, how's your foot? Oh, it's healing. You know, I'm seeing different doctors. But I'm just laying it all out there. The swelling was pretty significant. By the mid to end of the week, it would be so bad that sometimes we'd get home and I'd sit, and if I went to get up to make dinner, go to the bathroom, do something basic, I could hardly move and walk on my foot. I would often be dragging it behind me. And the only way to get it less swollen by Monday was to stay home on the weekends with my foot up and iced. So we would end up watching church on YouTube. Thankfully, we had that. But it also meant we couldn't go outside. We couldn't go for our walks, which that's not fair for a 7-year-old. And it had been tearing at me. You know, she's seeing pictures of our friends on Facebook. They're going for hikes, going for adventures. I could hardly walk to the other side of the apartment complex to get the mail without something in my ankle popping. It really started popping, giving out, rolling. So I brought that up to the podiatrist in January, and I had two choices. Basically, I could live forever with this and always wear a brace, or he encouraged me to really consider surgery. He wanted to see how things would go over the next month, let me think about surgery. And the pain was just, it was emotional and physical, because I'm seeing my daughter look outside our beautiful apartment complex. It's really, really pretty. I could hardly even walk up the stairs to go to the grassy area. And of course she wants to play. Of course I want to play with her. But I just couldn't, at the end of a work day, I just couldn't do it. So February, I told him, let's do the surgery, and walked me through it. He'd go in orthoscopically on the front of the ankle, check things out, clean up any scar tissue, things like that. Then he'd make the incision, go in, take out the bone fragment, and tighten up the ligament. So the ligament's going to be tighter than normal once I get this splint off. So that's to be expected, and physical therapy will stretch it back out. So that was going to be the simple procedure. Got that scheduled for March 23, first day of spring break. Was working on getting all the sub plans set up. Thank you to those who were going to substitute for me. Got everything put in file folders, labeled what was for kindergarten, what was for first grade. It was just good to go. Photocopied pretty much everything. And then this COVID-19 thing started, and I thought, you know, what if I'm out from surgery? And because I was hearing about schools in California closed, and I thought, what if something like that happens for us? The irony, when I've got a substitute. So I went on a Teachers Pay Teachers and found some more no prep packets that I actually had done some last year with my initial break. I hobbled in there and printed them off. My mom helped me photocopy, and they were golden for a couple weeks with that and math. And then more and more teachers started putting these products up on TPT of 3 weeks worth of this, 3 weeks worth of this, because everything from the other states in my Facebook teacher groups that I'm in was like, oh, well, we're going to be closed for 14-day quarantine. Oh, well, they're having us closed for 21 days. So everything was in 2 and 3 week increments. So I thought, well, this is perfect. This 3-week thing, it covers all of our math, everything. So printed those out, one for K, one for first grade. So all the sub would have to do is photocopy, staple, and send it. We're good. So, and we had the MBA, Monterey Bay Academy Music Festival was the week before. And so I had a couple of substitutes lined up for that. And we were going to leave on Wednesday. Tuesday night, that got canceled. And that's when I started wondering, okay, something's going to happen. If it's being affected in California, we're right next door. So, and then our school closed. And then my surgery got postponed. And then all of this happened. Everything went to digital, which was actually, my doctor said that was a huge blessing because I got to have it elevated. I was at less risk for injury sitting at a computer teaching digitally where I could have my foot elevated. But even still, it was popping, it was rolling, and all non-elective surgeries were canceled. So I'm like, I'm gonna have to live with this. So lots of Motrin, lots of frozen bags of veggies that Lynn would get for me. She's been very sweet, very patient through most days. We all have our days. And then I got another appointment, and I have to go back every 4 weeks anyway. I started having new pain on the inside of my ankle where there had actually been some significant bruising after the break. So, and the podiatrist thought he was pretty certain that it was my body compensating. My knees started swelling, like my kneecap was gone. I got chunky knees anyway, I'm gonna admit, but like there was no kneecap. It was just one big, and it was like swelling going down to my shin. So it was pretty bad. My body was really trying to compensate. So end of April, they had just gotten word down the pipeline that non-emergent surgeries that were at risk of further injury if not done soon could be scheduled. Just this very specific category of people that I happen to fall in, because with the new pain, with the popping, the rolling, my lack of trust in the foot had my podiatrist put me in that category. And he had told me that I would be among the first patients scheduled once surgeries were cleared. So having this news was actually great. I thought, we're still in quarantine. It's the end of the school year. I can still teach with my foot up. Let's do this. So I got the call, got it scheduled. I had to do all the pre-surgery things. We had a week to get all of the pre-surgery clearances done, including COVID-19 testing. My mom had to arrange to get time off of work. Luckily, we've had wonderful weather until this weekend. I'm looking out at wind and rain and gloomy skies, but we haven't had a lot of snow, so my mom decided it's safer for me to drive. So she drove up, arrived the Friday afternoon before, and we went to work, cooking, cleaning, prepping everything, making a pathway for me to go through on crutches. We basically made my apartment as handicap accessible as possible. I had ordered a shower bench. We put that together. So that's pretty much what the first couple days were. And then Monday, the 11th, I had my surgery, and I don't really remember a whole lot from, this is where it gets kind of funny. Sadly, I had to go in alone. So Lynn and my mom came back to the apartment. Apparently they played some board games that I had bought in preparation back in March, actually. And Lynn and I have been playing the games all along, but she wanted to play with grandma. So that was super special. So they did that, and they watered the plants. They went for a walk. I told my mom, anything you can do to keep her busy, do it. So they did. They had lots of fun. I had wonderful staff. The nurse, he was amazing and hilarious. I really, really like my doctor. He's very competent. The anesthesiologist was very professional. All the nurses were very friendly, and I was able to crack some jokes, and they would laugh. I'm like, I'm determined to be that patient that's not grumpy, the one that's going to make you laugh, because I'm in any customer service related field, whether it's fast food or medicine or teachers, you're going to be dealing with grumpy people. I'm determined to not be that grumpy person. I want to be that little sparkle. And I love that Lynn is the same way. So give them a little bit of brightness. I don't really remember much. Things start getting fuzzy from when the anesthesiologist came in. And he was going to do a nerve blocker from behind my knee. So from the knee down, was really going to concentrate on a nerve blocker for pain. And they told me that they would have to use less anesthesia to keep the senses down. They gave me a lot of pain pills before that, but I don't really remember too much from when he put in, my dad called it the loopy juice. Don't know what it was called, but man, I remember staring at the ceiling, and the ceiling tiles were the ones with little dots. And I remember staring at them going, those things are moving. So I know that was the medicine. And they had to keep asking for my name, my birth date, what foot they were doing surgery on, what they were doing. And it got really hard after that medicine went into my IV. And like, these are really hard questions all of a sudden. So, and he did the nerve blocker, and then they wheeled me into the OR, and the nurse that was pushing the bed, oh man, she was just laughing. I don't really remember what I said, but something along the lines of, this is probably where all the fun stuff starts for you nurses, with people not having much control over what they say or do. And she was just laughing, and they had me scooch over to the bed and lay back, and they gave me some oxygen to breathe, and they said, okay, we're gonna get going, so you're gonna take a few deep breaths. And I did, and everyone's just kind of chattering around me. I don't even know if they asked me to count down. I was out. So 1 minute, this lovely nurse with a really cool cat print cap. I do remember complimenting her on that and saying, I like her mask. I like her scrubs. I did also confess that when I was little, I wanted to be a nurse because I wanted to wear fun, cute scrubs. And then I learned from my aunt, who was a wonderful nurse, she's retired now, helped me realize they deal with a lot of blood. And I decided, since I don't like blood, that nursing wasn't for me. I give so much credit to people who are nurses. I just can't do it. So, and she thought that was funny. We were laughing the whole way to the OR. So, yeah, I don't remember much from take a few deep breaths to, okay, wake up. And it was really hard for me to wake up. There was a lot of beeping. Apparently, I don't breathe deep enough when I'm kind of dozing. I was a little nauseous. They gave me some ginger ale. And as soon as she told me that once I start to wake up, they can get me dressed and get me home, oh man, that snapped me alert. So they had already called my mom, and they were anxious. And when I say they, I think it was the smaller of the two who were coming to pick me up, were anxious. So the nurses were really sweet, helped me get dressed and alert. And I smiled a lot, apparently, because I remember somebody commenting on that, and they wheeled me downstairs. And the sweetest sight of that day was when we got to the pickup and drop off driveway. And is that your mom's car? And I went, and I kind of recognized it. And then I saw a hand waving like crazy through the back window. I'm like, oh yeah, it's my daughter. Look how cute she is. And it was very tough to get in the back seat of the car, but I knew that Lynn had moved all of her. She was holding all this stuff. So I knew that she had expected me to sit in the back seat.
Yeah, but my grandma kept on saying, come on.
Well, it would have been easier to get in the front seat. but you know.
My grandma, my grandma named Dee Dee,
Yep.
kept on saying, come on in the front seat. No.
And then I
go
said,
back.
but the back seat's so much closer. So we got in the back seat, and what did we have for lunch?
Chick-fil-A.
Oh yeah, that's right. Don't even remember that we had Chick-fil-A for lunch. And then we got home, I had Chick-fil-A, and we passed out. And by we, I mean me, for several hours. I vaguely remember someone coming in and touching my back and a little hand stroking my cheek. So I know that I was checked on, but man, that stuff knocked me out. Even once I was once you're in your own bed, all bets are off. So first couple of days, there was a lot of pain, a lot of napping. So, but it's been getting better day by day. And I've just realized how long this kind of explanation and buildup has gotten. So we're probably going to have to do a part 2 for what I had planned, which is fine. So, because for those who may not know the whole background, that's pretty much the story of how I broke my ankle and how it led to surgery. So I will end it here. And in the next segment, as I mentioned at the very beginning of this long chit chat, we will be doing something artistic to my foot splint. So stay tuned, and the art is coming next. All right, I've got my mouse up here. All right, so see ya in the next one.